Well, Dr. John Campbell is a health analyst based in England. He joins us from Carlisle. Welcome to DW, Doctor. What is it about this Delta variant that means that so many countries are now increasing pandemic restrictions when they were just emerging from lockdown?
It's also disappointing, Phil, isn't it? You know, things were looking so good and now all of a sudden we've got what is essentially a third wave. This virus basically first arose in India. Many people travelling from India to the UK brought the virus to the UK. Now, there was many thousands of people coming from India to the UK before we restricted travel. So we had multiple seeding events. So the virus was able to get a foothold in the UK. From the UK, it spread on to Portugal, for example, largely as a result of UK holidaymakers. It is now spreading throughout Europe. About 95% of the cases in the UK are now the Delta variant. What seems to happen is people get infected with a smaller inoculum, a smaller number of viruses needed to get infected, and they then produce a very high viral load, which means they shed more of the virus. So we've got greatly increased transmission, about 64% greater transmission in households than the previous Alpha UK Kent variant. And of course, that was about 40% more transmissible than the original wild type variant.
So just to be clear, it's more easily transmissible, but it doesn't seem to be killing more people.
Well, there is a slight increase in hospitalisations in the UK, although that's not dramatic. There's been 58% more cases in the past week in the UK, but hospitalisations up much less. Now, that's largely because we're protected by the vaccines. But there is some early indications that it is making people somewhat sicker, not a lot, not dramatically so. But this would be consistent with the idea that this virus generates a higher viral load in the person, making them more infectious, but also potentially making them sicker. But more data to come on that yet, and no reflection in increased deaths as of yet.
And is there now consensus on which vaccines are or aren't effective against this Delta variant?
Yes, we do know that both of the vaccines that we're using primarily in the UK, which are the Pfizer and the AstraZeneca, are effective. So after 2 doses, they're very effective. Now, after 1 dose, the effect is really quite small, about 35 to 36% after the first dose. But after the second dose, that goes up to about about 88% efficiency. So going up from 35 to about 88% efficiency after the second dose. And this is part of the problem as well, of course, because the Delta variant, really, to protect people against symptomatic disease, is we need 2 doses and 2 weeks after the second dose. So we have this delay effect as well. But both the Oxford and the AstraZeneca vaccine are very effective at keeping people out of hospital. And people that get vaccinated are very likely to be asymptomatic or have 1 or 2 symptoms, as opposed to 5 symptoms that we got before vaccination. Right. And the symptoms are likely to be milder.
Now, we're at the height of the summer travel season. Some countries have reopened to tourists under certain conditions, and we have thousands of people travelling to the Euro 2020 football venues around Europe. I wonder if another spike in cases is inevitable.
Is this going to be a super spreader event or a series of super spreader events? Now, with the previous variant, even with the Alpha variant, the UK variant, that wouldn't have been the case because it was not as transmissible. And you might remember with the protests in the United States last year, where we were worried about outdoor transmission, but that never happened. But this one is so much more transmissible now. Outdoor spread is a possibility. And indeed, we know that there's 5 people in Denmark who've attended a Euro match, and 5 of those people have become actually positive for the Delta variant. And the Danish epidemiologists are pretty sure they contracted it at the football match. So previous variants, I wouldn't be worried, but because of this Delta variant's transmissibility, I must say the Euros are really quite a big gamble that we're taking at the moment.
OK, thank you for joining us and explaining that so clearly. Health analyst Dr. John Campbell.
Thanks, Phil.